Because it's a possibility of other exposures there, theoretically, we're going to test everybody there for TB with a skin test. Most of the children are going to get, the younger ones up to about age 4, are going to get preventive treatment with medication, just because skin tests are not that reliable in children that young, and we don't want to take any chances. The younger the child, the more at risk the child is for having TB beyond the lungs, went into the brain with meningitis and septic. Understand that the test does not diagnose TB. It gives you an indication of exposure in some sense, but it's not the diagnostic test in any one case. A positive test does not mean the child has TB. There are some people who react to the antigen for other reasons, and a lot of people have a positive skin test walking the streets today who don't have TB. So we have no reason to believe that all these kids are going to get TB. In fact, we know they're probably not. There would be an isolated case or two.
TB is not unlike any other epi investigation that we do, from foodborne to vector-borne. We make sure that we are contacting those people that have similar symptoms that have been designated by those patients, and if there's any certain area that may lead us to look into more seriously, for instance, a daycare or a school or a restaurant, we will go and contact those places and see if there's any other things that may be occurring at that time. And then from there, we provide any prophylaxis and education that may be needed. And that's pretty much what we do, and that's what we're doing right now.
With a case, we have to go out and provide direct observation therapy to watch the patient take their medication so that they can get well. Now, when we're looking at TB infection, which is LTBI, that person is not infected and they take their medication on a 9-month basis. Whereas with a case, they're on medication DOT by the staff at the health department for approximately 6 months. So,
what is the danger to the general population outside of the daycare center?
if a patient take their medication, there is no danger because we are monitoring them closely, so there is no danger.
And you can't spread it if you're not symptomatic, correct?
You cannot.
Whenever we have any disease that was reported to us, we do a contact investigation to try to see if there are any more people that need any medication or testing. Anybody that is positive, you can feel sure that they're being taken care of. The Macon Bibb County Health Department, along with us, we will be providing skin tests and chest x-rays at no cost.
TB is preventable and it's treatable and curable. And much of all this activity is done in the utmost spirit of precaution. And so we want to get that message out to everybody. It's also important to communicate that we do not know who the source patient is at this time. And that's part of the ongoing investigation. So please, on an ongoing basis, go to the website. You can get all the facts about TB. You can call us. Again, the district office is going to the daycare itself to communicate with the parents, family members, neighborhood, whoever wants to get more information and hopefully allay some of their fears.